Every morning, millions of seniors reach for their familiar comfort foods, white bread slices or sugary cereals, thinking it's a harmless start to the day. They believe these foods are quick, easy, and harmless, but behind that everyday ritual lurks a silent threat. These simple carbs cause sudden blood sugar spikes that are almost invisible to the eye but have devastating effects inside the body. When you eat white bread or sugary cereals, your blood sugar can rise sharply within just 15 minutes, often reaching levels well above 140 mmHg, which triggers an inflammatory response inside your arteries. This rapid spike causes your blood vessels lining the endothelium to become inflamed and damaged, unleashing a cascade of long-term effects that usually go unnoticed until it's too late. Over the span of months, this repeated pattern of blood sugar surges begins to cause tiny injuries to the arterial walls. The body's natural repair response kicks in, but with constant inflammation, thin layers of fatty deposits start to build along the damaged areas. These deposits, known as plaques, are composed of cholesterol, cellular debris, and other fatty substances. They form along the inner walls of arteries, often growing slowly and silently without causing noticeable symptoms. Medical scans reveal that even in asymptomatic seniors, these plaques are quietly expanding, compromising the flexibility and openness of blood vessels. If left unchecked, these plaques can begin to harden, turning into calcified, less flexible structures that narrow the arterial lumen, making blood flow sluggish and more vulnerable to further injury. The danger escalates dramatically when these fragile fatty deposits become unstable. Many plaques develop a thin, fibrous cap that protects them, but due to ongoing inflammation, this cap can weaken and rupture unexpectedly. It's common for a person to be engaged in minor movements, standing up quickly, twisting, or even coughing, and suddenly a rupture occurs. When this happens, the inner core of the plaque, rich in lipids and cellular debris, is exposed directly to the bloodstream. This exposure triggers the formation of a blood clot or thrombus, which can quickly grow in size as platelets and clotting factors rush to seal the rupture. These blood clots can become large enough to completely block the artery within seconds, obstructing blood flow to vital organs like the heart or brain. The process is so rapid that the clot often forms before the individual even feels a warning sign. This sequence of events illustrates a deadly chain reaction that begins innocuously with that morning bowl of cereal. The initial blood sugar spike damages the arterial lining, setting the stage for plaque development. Over time, these plaques grow fragile and prone to rupture with even minor physical stress. When a rupture and clot formation happen, blood flow to critical areas is cut off instantaneously, leading to sudden strokes or heart attacks. These catastrophic events often occur without warning, catching victims unaware. Medical studies have shown that in a significant percentage of seniors who die suddenly, the root cause is a ruptured plaque inside an artery blocked by a blood clot. Yet the warning signs are often silent until it's already too late. Blood clots that form deep within the arteries begin their deadly journey silently, traveling with no visible warning. They navigate through the bloodstream at speeds of up to 30 centimeters per second, propelled by the natural flow of blood, which can reach velocities of 25 centimeters per second in healthy arteries. These tiny obstructive clots often lodge in critical arteries supplying major organs like the heart and brain, drifting until they become lodged at arterial bifurcations or narrow points with diameters less than 2 millimeters, causing partial blockages. This subtle obstruction reduces blood flow by roughly 50%, which can manifest as sharp chest pain that lasts for several seconds or slurred speech lasting a few minutes, yet most seniors dismiss these signals as minor, temporary glitches, unaware of the impending catastrophe. But this initial partial blockage is merely the prelude. Once lodged, these tiny clots can remain dormant for hours or days, gradually enlarging by accumulating platelets and fibrin from the blood. The process of growth occurs at a measurable rate of approximately 0.2 millimeters per hour. During this period, the clot acts like a ticking time bomb, occasionally causing transient ischemic attacks that mimic benign symptoms, but gradually weakening the artery's integrity. In some cases, the clot's surface becomes unstable due to ongoing inflammation, leading to rupture of the underlying atherosclerotic plaque. When this rupture happens, it exposes the inner core filled with lipids and cellular debris to the bloodstream, igniting a cascade that unleashes an unstoppable formation of larger, more dangerous clots. This cascade is characterized by a rapid accumulation of clotting factors that increase the clot size exponentially within seconds. If the clot reaches a critical diameter of nearly 10 millimeters, it can occlude the entire artery with astonishing speed, often within 30 to 60 seconds, cutting off oxygen and nutrient delivery to vital organs at once. The consequences are stark and deadly. Inside the brain, this results in an ischemic stroke that causes irreversible nerve damage if not dissolved within 4.5 hours using targeted clot-busting procedures at precisely 41 degrees Celsius and with administering 10,000 units of tissue plasminogen activator carefully infused over an hour. Equally catastrophic is a clot blocking the coronary artery that supplies the heart muscle itself. When the blood flow is cut off, heart tissue begins to die within 6 minutes. The area affected can be a segment 30% of the wall thickness or more, making recovery impossible without immediate intervention. The true peril lies not just in the initial formation, but in the rapidity and size of these clots, once they reach critical volume inside arteries servicing the brain and heart. The process occurs so swiftly that an artery can go from nearly open to completely blocked in less than a minute. No warning symptoms emerge fast enough for the victim to realize the danger. In these moments, catastrophic, irreversible damage is sealed in seconds. The oxygen-starved tissue in the brain or heart sustains permanent injury, leading, in many cases, to sudden death before emergency responders arrive. Medical literature records that in nearly 70% of sudden, unexpected deaths among seniors, the root cause is this silent cascade of blood clots forming inside critical arteries, illustrating a terrifying pattern of hidden danger that strikes without warning. Once a blood clot lodges in a critical artery, the cascade toward disaster accelerates with terrifying speed. Within seconds, the tissue supplied by that artery begins to suffocate as oxygen and nutrients are rapidly cut off. In the brain, this ischemic event results in a stroke, causing irreversible nerve cell death. The loss of brain function manifests suddenly, often without warning signs, leaving victims unconscious or incapacitated in moments. An average ischemic stroke due to arterial blockage can cause permanent neurological deficits if not promptly dissolved within 4.5 hours. In clinical practice, emergency physicians locate these blockages using advanced imaging such as CT scans or MRIs and administer clot-busting agents like tissue plasminogen activator carefully infused at precise temperatures and dosages. The medication must be given within that critical window to maximize the chance of restoring blood flow before irreversible brain damage occurs. In a similar fashion, a blockage in a coronary artery spells immediate doom for the heart muscle, beginning with chest pain radiating to the arm, neck, or jaw, and rapidly progressing to tissue death if blood flow is not swiftly reestablished. Heart tissue starts to die within a mere 6 minutes of complete arterial occlusion, resulting in a segment of the heart muscle becoming non-functional, which dramatically diminishes cardiac output. A heart attack can happen so suddenly that the victim may collapse or go into cardiac arrest before emergency responders arrive. The affected area can involve as much as 30% or more of the heart wall, often leading to lifelong complications or death. The rapid progression from partial to full occlusion is potentiated by the size and speed of clot formation, which occurs so swiftly that the artery can go from nearly open to completely blocked in less than a minute. Because symptoms develop insidiously and progress so fast, victims are often caught off guard, unable to call for help or take protective measures. The tissue death occurs irreversibly once blood flow is interrupted for more than a few minutes. Medical records and autopsies reveal that in close to 70% of unexpected deaths among seniors, the root cause is a silent cascade of blood clots forming inside critical arteries. These clots are often the unseen culprits behind sudden death, hidden behind the guise of mild symptoms or no warning at all. They are the invisible killers lurking within the bloodstream, silently developing over months and years until they unleash catastrophic, irreversible damage. This devastating process underscores the importance of proactive prevention. The only way to halt this deadly chain is through a simple yet powerful dietary adjustment. Replacing a traditional carb-heavy breakfast, such as white bread or sugary cereals, with an anti-inflammatory alternative, like oatmeal topped with a handful of fresh berries and a small handful of walnuts, can make a life-saving difference. Consuming 3 tablespoons of dry rolled oats, cooked with 200 milliliters of hot water at 100 degrees Celsius, then adding a half cup of blueberries and a quarter cup of chopped walnuts, provides an abundant source of antioxidants, omega-3 fatty acids, and fiber. This combination reduces systemic inflammation, promotes endothelial health, dissolves existing plaques, and prevents new deposits from forming. Eating this breakfast at the same time each morning, ideally within 15 minutes of waking up, ensures a steady anti-inflammatory response that can significantly lower the risk of deadly blood clot formation. Incorporating this healthful change has been shown to decrease blood sugar spikes, stabilize cholesterol levels, and maintain vascular integrity over the long term. Such a simple switch has the potential to save countless lives by halting the insidious buildup of unstable plaques and preventing their rupture, averting the silent cascade that leads to sudden, catastrophic death.